Specialists from WellSpan Cancer Institute are here to talk about what causes lung cancer, the symptoms to watch for, and who should get screened. Lung cancer kills more people in the U.S. annually than breast, colon, and prostate cancers combined. We know that smoking increases your lung cancer risk, but you might not know that lung cancer can have other causes. We'll explore the importance of early detection, risk factors, and treatment options, and hear how nurse navigators support patients and families. We'll also meet a local patient who, after robotic surgery, is back to enjoying life. Plus, happening right now, experts from WellSpan Cancer Institute are taking your questions during a live web chat. To ask a question, visit abc27.com/WellSpanLung.
The following portion of Good Day PA is sponsored by WellSpan Cancer Institute.
A Lebanon County woman is celebrating life after a routine screening led to an early cancer diagnosis. 61-year-old Lori Nauman says she's grateful for the care that caught it in time. Janelle Knight has more.
A routine screening can save your life. That's the message from a Lebanon County woman who says early detection gave her a second chance. Lori Nauman loves to travel, exploring different places and states. Last year, she went on her first cruise.
I like going different places, even if it's just to a yard sale in a different county.
But this year brought an unexpected journey. Lori is a smoker, has been since she was 14 years old. With cancer running in her family, she decided to get screened.
I really wasn't surprised, to be honest. I didn't think I would have lung cancer. I just thought, okay, I'll have some kind of cancer because it's in my family, but I never thought lung cancer. You never think it'll happen to you, and it did.
She'd had a persistent cough her whole life, but never imagined the worst.
I coughed in my sleep all the time, like I'd wake myself up, so it was pretty bad. But you still don't think you have lung cancer.
But the screening caught it early. Dr. Anis Ali, a thoracic surgeon at WellSpan York Hospital, says that's critical.
If you can detect things early, you can treat them more efficiently.
The problem is most smokers don't get screened, even though it's recommended for adults between 50 and 80 years old who have a significant smoking history and who currently smoke or quit within the last 15 years.
I think a national average is actually less than 10%. People are eligible for this screen getting the scan.
Dr. Ali says one reason for the low screening rate is stigma.
There's sometimes that idea that I caused it myself, which is not the way it should be, because any disease happens to any person, and nowadays with all the advancement we have, we want to treat them early so we can get a better control of the disease early on.
What also helped Lori was WellSpan's multidisciplinary and personalized approach to her care. After her screening, her doctors were able to work seamlessly together.
We all get involved with the primary care. We have that interaction between each other to know the patient is aware of the next step.
Lori's next step was a biopsy along with a PET scan. A team of doctors decided a robotic lobectomy would be the best option. This minimally invasive procedure uses small incisions and robotic technology, allowing fast recovery with less pain. Lori did so well that she went home the next day.
My nurses were great on my floor. My doctor, I love him.
The recovery meant about 2 months off work as she regained her strength and breathing. Today, Lori is doing much better. The coughing fits that kept her up at night are gone, though she still uses an inhaler.
I think I'm doing pretty good for not even being 6 months out yet.
She's back to her activity with no limitations, and she's enjoying her life the way she did before.
Her goal now?
To get 5 years of clean scans. Because then after that, then they can say I'm cancer-free.
Lori turned 61 in October and has a message for others about early detection.
Don't put it off. It could save your life. It's plain and simple. Don't put it off. I'm glad I'm here to see another birthday. Sometimes I'll sit back and I'll think, oh my God, what if I never got the screening? A year from now, it could have been stage 4.
Now, Lori says she has faith in her doctors and WellSpan Cancer Institute, and she's grateful that early screening gave her a fighting chance. And good news, Lori just had her 6-month scan showing no new cancer in either lung. Back to you, Amy.
Thank you, Janelle. Joining us is Dr. Anis Ali, thoracic surgeon with WellSpan Cancer Institute, and Lori Surgeon. What are the most common risk factors for cancer? What are the causes?
So, one of the well-studied causes has been smoking. Unfortunately, still people smoke and knowing the risk. Secondhand exposure also is a risk. Sometimes you're not a smoker, but you're exposed to smoking, and that puts you at risk of lung cancer as well. One of the things in Pennsylvania here is radon exposure, and that's something that people start to test in their houses. But the strongest association and causation is the smoking. Other causes, it could be environmental exposure, occupation as well. But some people can have cancer because of genetic mutations as well.
What symptoms should people be looking for, and when do they know that they should see a professional?
Unfortunately, with lung cancer, it does not have specific symptoms. So most people actually will not have symptoms. And that's why screening scans are really important. And that's the way we discovered it with Lori. Some symptom that would be really concerning if someone is coughing blood, persistent coughing like she had, or unexplained symptoms of the chest. It's always good to seek medical advice, and especially if you have the criteria to get screened, it's better to actually get screening.
A lung cancer diagnosis is very scary, and in Lori's case, her treatment involved robotic surgery. What other treatment options are available?
So whenever we assess a patient, the critical thing is assessing his overall functional status, his reserves. Surgery is the gold standard, because if you can take out the cancer, that would be the best curative long-term survival option. But other options include radiation. There's a lot of new advances of chemotherapy, immunotherapy, which has changed the horizon of how we manage lung cancer. But again, I'm going to circle back. Lung cancer screening helps us to detect it early, and once we do that, that will give us the best option to cure it.
Well, in terms of the screening, who should get screened and when?
So when it comes to lung screening, there was studies. The first proven study that showed lung cancer can help was a study from 2011, National Lung Screening Trial, which showed if you screen a patient with a CAT scan, you can detect cancer early and you can improve survival. Unfortunately, the studies before that did not show. That was based on X-rays. So that study showed if you can detect the cancer, actually you can cure it and improve survival. So at that point, the recommendation was anyone who's a smoker at the age of 55 will get screening. 3 years ago, they actually modified it and increased it to the age of 50 now. So anyone at the age of 50 who's a smoker or quit smoking in the last 15 years should get an annual low-dose CAT scan. And one of the questions people ask is, CAT scan, a lot of radiation. When it talks about low dose, it's actually low radiation compared to the regular CAT scan, but it gives us the information we need to detect the cancer.
Well, tell me just a little bit more about that, just how effective it is.
So it's extremely effective. It's really sensitive, meaning we can detect small nodules, and once you do it, which usually is how cancer presents, it's something abnormal in the CAT scan. There's a lot of advancements how to work things after that, meaning not all nodules means they are cancer, but it's important for us to detect this so we can take the next steps.
Very good. Interesting. Thank you so much for all your expertise today, Dr. Ali. Well, for more information, or if you would like to make an appointment with WellSpan Cancer Institute, visit wellspan.org/lungcancercare. As part of this special Good Day PA, ABC 27 and WellSpan Health Institute are hosting a web chat. To ask a question, go to abc27.com/WellSpanLung. Janelle Knight joins us with some viewer questions.
All right, thanks so much, Amy. Dr. Marianne Spengler, medical oncologist with WellSpan Cancer Institute, is here with us to answer some of our viewer questions. This viewer wants to know, can non-smokers get lung cancer?
Yes, about 10 to 20% of lung cancer cases in the U.S. occur in people who never smoked or who only smoked a few cigarettes. Other risk factors for lung cancer include some of the things Dr. Ali mentioned, so secondhand smoke, air pollution, exposure to radon gas, and workplace chemicals. Genetics can also play a role.
It's very interesting because a lot of people just think it's smokers. All right. Let's go to our second question. Okay. I have a history of cancer in my family. Should I be screened earlier?
Yeah, family history is very important, especially if it's close family members who were diagnosed with lung cancer. The current guidelines for lung cancer screening focus on age and smoking history, but it's worthwhile to discuss with your doctor your family history because they may recommend an earlier or more frequent cancer screening specific to your background.
And that's why it's important to talk to your family about it too as well. Some people
Right.
keep their medical history private and they don't discuss things like that.
Yeah, that is common.
Okay. All right. And this viewer wants to know, I have been trying to quit smoking for years. What resources does WellSpan offer to help?
Yeah, quitting is hard, but know that you're not alone. WellSpan does have a lot of personalized support available, including counseling, nicotine replacement options, medications. They also have support groups and digital tools to help you stay on track. The most important first step, though, is to reach out because our teams are ready to help.
Okay. You don't have to do it alone.
That's right.
All right. Thanks so much, Dr. Spengler.
You're welcome.
We'll be back a little later to answer more viewer questions. We're getting quite a few in. Back to you, Amy.
Thanks, Janelle. Coming up next, we'll learn how WellSpan Cancer Institute guides patients on their difficult journey after a lung cancer diagnosis. Also, hear about the latest therapies and clinical trials underway at WellSpan Cancer Institute. Keep it here. Welcome back. Joining us now is Dr. Nikhilesh Korgaonkar, thoracic surgeon with WellSpan Cancer Institute. Can you explain the different types of lung cancer?
Yeah, so there are two general categories of lung cancer, small cell and non-small cell. Small cell tends to be less common, a little bit more aggressive. Within the category of non-small cells, there are various types, including the most common, what's called adenocarcinoma and squamous cell carcinoma. And the specific subtype helps us decide what the right treatments might be.
So once you get the diagnosis, what then are the next steps?
Yeah, it's obviously a very difficult time for patients.
For sure.
And one of the most important next steps, although the patients might be seeing just one doctor face-to-face, their case is discussed in a multidisciplinary team. So we bring together surgeons, oncologists, radiation oncologists, pulmonologists to decide on what the right course of care is for the given patient. That may include a biopsy, it might include additional studies for staging the cancer before we actually move on to treatment.
So then it sounds like you really take everything into consideration and really personalize the care. How are you able to personalize the care?
Yeah, I think the multidisciplinary evaluation is such an important part of that. Cancers are complex these days, and a generation ago, if you saw a surgeon, you got an operation. These days, it's so important to work together to make sure that we're taking into account all the possibilities for care. We also want to take the patient's preferences into account, so that's a very important part of it. And then on the more scientific level, many of our cancer treatment options are informed by the molecular signature of the tumor. So we use advanced pathology techniques to make sure that we're looking at sort of the genetic makeup of the cancer, because that might change what we do.
Wow, that's so interesting.
Yeah.
Things are consistently changing. So are there any new potential therapies coming through or clinical trials underway right now?
All the time, yes.
Good.
I think that we're really proud to be a robotic center of excellence. So one of the things that we are advancing on and making progress on is less and less invasive techniques. You heard about robotic surgery from Dr. Ali. We're also conducting clinical trials all the time within each of our cancer centers, and also through our collaboration with Johns Hopkins. So we have access to not only our own set of trials, but to their trials as well. And there are some really interesting, promising new therapies coming out for small cell lung cancer in particular, things called BITE therapies. At the moment, those treatments are really only available at the largest academic centers. We're working actively with our partners and collaborators within WellSpan and outside of WellSpan to bring that to South Central Pennsylvania for our patients close to home.
That would be huge.
Yeah.
Huge. Wow.
Yeah.
Okay, so a cancer diagnosis, obviously awful, but you can feel good knowing you can get excellent care right at WellSpan. Thank you so much,
My
Doctor.
pleasure. Thanks
Great
for
to have
having
you
us.
with us. For more information, or if you would like to make an appointment with WellSpan Cancer Institute, visit wellspan.org/lungcancercare. We'll be right back. Joining us now is Amanda Coble, nurse navigator with WellSpan Cancer Institute. What role does a nurse navigator play in a lung cancer patient's journey?
So a nurse navigator is a guide, an advocate, and a support system for patients. We help to coordinate appointments, explain treatment options, and be available for any patient step of their journey and help them understand their treatment. One of our goals is to help patients feel comfortable and reduce stress and move things along smoothly.
At what point does a patient get to meet their nurse navigator?
Typically, our patients are connected with a nurse navigator on initial diagnosis. We do like to get involved early. That way we can help ensure timely care and also provide the patients with a point of contact that they can trust from the very beginning.
No, this is totally different from the medicine side of everything. You're supporting patients emotionally, mentally. How do you do that?
So as nurse navigators, we listen, we check in with our patients, we attend their patient appointments, we connect them if needed with counseling, support groups, and wellness resources. Treatment can be very overwhelming, and so it's very important that they feel heard and supported during the process.
It's overwhelming, it's scary, and not just for the patient, but for their loved ones, their families, their caregivers, and you offer support there too.
We do. We have a support services team, which includes our not only nurse navigators, but social workers, financial counselors, dietitians, and our social workers. And we do get them involved early, and we also, as nurse navigators, we help to families navigate the system as well as the patients, because supporting the family is also supporting the patient.
You know, you see folks kind of in what can be considered one of their darkest times, right? But you're able to give them some light. Do you get feedback from them saying, thank you, you helped me so much?
Definitely, yeah. Yeah, patients are very appreciative to have the service, to have nurse navigators as well as our support team. And they're very appreciative of the care and support that we provide.
It's a terrific thing you do. Thank you so much for what you do, and thanks for being on the show with us today.
Thank you.
For more information, or if you would like to make an appointment with WellSpan Cancer Institute, visit wellspan.org/lung cancer care. We'll be right back. Welcome back. As part of this special Good Day PA, ABC 27 and WellSpan Cancer Institute are hosting a live web chat. Janelle joins us again with more.
All right, thanks, Amy. Dr. Nora Sudarson, medical oncologist with WellSpan Cancer Institute, is with us now to answer more viewer questions. Okay, the first question, why is vaping popular and is it safe?
Vaping has become popular as a safer alternative for smoking, especially in young people. It's marketed with appealing flavors and sleek devices, but it still is not without risk. Vaping still does expose the lungs to harmful chemicals, and it can cause long-term damage. It's especially concerning in teens and those who have never smoked.
Okay. Well, can lung damage from smoke or vaping be reversed?
Some damage may be reversible, especially if you quit early, but the lungs have a limited ability to heal, so stopping smoking or vaping is the best first step. In general, it's a good idea to try to always go ahead and please talk to your doctor if you have any questions, because we want to always cut back on any damage that could be done.
Okay. All right, let's go to our next question. Can lung cancer be cured?
Yes, lung cancer can be cured, especially if it's caught early. Treatments such as surgery, radiation, and newer therapies have improved survival rates. Early detection by screening is key, and ongoing research continues to offer hope through clinical trials and personalized therapies.
It seems like the common theme is we should have a good relationship with our doctors.
Yes, if there's ever any question, reach out to your doctor to make sure everything is going okay.
All right. I know you are getting a lot of questions. Thank you so much, Dr. Sudarson and Dr. Spengler, who is over there typing, answering your questions. They will be here until 11 o'clock answering your questions, so keep them coming. Stay with us. We'll be right back.
Welcome back. We thank the team at WellSpan Cancer Institute for today's special program, and of course, Lori for sharing her story with us. Our lung cancer web chat will run until 11 this morning, so you still have time to get your questions answered. For more information, or if you would like to make an appointment with WellSpan Cancer Institute, visit wellspan.org/lungcancercare. We have more to come on Good Day PA, so stay with us. We'll be right back.
The preceding portion of Good Day PA has been sponsored by WellSpan Cancer Institute.